Welcome to our course about incident investigation and learning in radiation treatment. This is a course that was developed jointly by the Canadian Partnership for Quality in Radiotherapy and the Canadian Institute for Health Information. My name is Michael Milosevic. I'm the chair of the Canadian Partnership for Quality in Radiotherapy. The program that you're about to participate in is really based around 7 independently guided online sessions that will teach you several aspects of how to go about investigating incidents in your radiation treatment program. Much of this will be based on the guidelines presented by the Canadian Patient Safety Institute. It will also work through the process of local and pan-Canadian incident analysis using the National System for Incident Reporting in Radiotherapy that has been developed by CPQR working with the Canadian Institute for Health Information. And the overall goal of the program is to raise the bar across Canada in terms of our ability to drive programmatic change and improve the overall quality of care that we're providing to our patients receiving radiation treatment for cancer. This is a brief outline of the course and what you will be learning over the next 7 sessions. I will talk very briefly today about the rationale for incident investigation and learning. The next 2 sessions will really focus on some of the CPSI guidelines about how to best analyze incidents when they occur. Session 4 will really focus on our National Incident Reporting System, NSIR-RT, and sessions 5 and 6 will build on the first few sessions and really focus on how best to classify incidents once they've been investigated using NSIR-RT. You'll meet a number of expert faculty over the next 7 or so sessions, people who are very, very involved in radiation treatment investigation and learning, people who have been very involved in the development of NSIR-RT, and people who really span the spectrum of those involved in the delivery of radiation treatment in Canada, from radiation oncologists to medical physicists to radiation therapists. These are the people, the key or core faculty who will be involved. And as you can see, it's a very multidisciplinary group who have spent a lot of time putting together this program and are excited about the opportunity that it offers to grow capacity and incident investigation across Canada. So just a few words about why we care about medical error in general and radiation treatment incidents more specifically. It's a very big problem in healthcare, and it was not well recognized until this report from the U.S. Institute of Medicine in 1999 really identified the burden of this problem, the burden on healthcare in the U.S. that medical error represents. And they really, through a series of investigations and pulling a lot of information together, identified that, almost 5% of hospital admissions in the U.S. are associated with some form of medical error, and that even more staggering is the fact that this contributes to almost, at the high end of the possible range, almost 100,000 deaths annually in U.S. hospitals, and that was nearly 20 years ago. To put that in perspective, it was the 8th leading cause of death in the U.S., higher than many other common causes of death that we think of, such as motor vehicle accidents, and actually it was estimated to cost almost $30 billion annually to the U.S. economy. The other very important point is that most of these medical errors are not the result of individual negligence or malevolence in any way. There really should be thought of as system-level failures where the structures that are in place within organizations are not adequate to detect these errors or minimize these errors from happening. And that of course reflected the state of affairs in the U.S. in 1999, but we're not immune to that either in Canada. And in fact, we know that the same kinds of things happen across the country in all levels and with respect to all kinds of medical intervention and medical care. And there was a very nice review of this kind of investigative report by the National Post about 2 to 3 years ago, that really commented on this problem in Canada. And I'm going to play that short video for you.
Most Canadians who wind up in hospital leave with their health problems better or even cured. Unfortunately, that's not the case for everyone. Widely accepted studies suggest that a startling degree of medical error also occurs, with as many as 23,000 Canadians dying yearly because of preventable adverse events, as they're now called, and that's in acute care hospitals alone. An investigation by the National Post confirms that a tiny fraction of those incidents are ever reported internally, and even fewer still are divulged to the public. And that's in contrast to accidents that cause and crime that causes death and injury in various other walks of life, especially in the aviation industry, where things like that are reported routinely. Why isn't it happening in healthcare? The reasons are complex, but experts say part of it is a culture within the healthcare system itself, and that culture tends to emphasize punishment as opposed to learning from mistakes. It tends to be very hierarchical, which discourages people from speaking out, from blowing the whistle. And of course, there's also the fear of lawsuits over mistakes as well. The issue is not about shaming and blaming individuals, say patient safety experts. In fact, it's rare that an individual a negligent individual is responsible for medical error. But these experts do say that if the public is not finding out about things, there's not going to be the pressure that's needed to force change to improve patient safety. And also, if people who work in the system don't learn about the mistakes of others, they're not going to improve safety themselves.
So I think that the video touches on a number of very important points that are common to medical error in general across the board. And also really are important considerations when we start drilling down a bit more and thinking about medical error in radiation treatment. And we know that this happens. It happens in each of our programs almost on a daily basis. Fortunately, most of the things that happen are not of significance to our patients in terms of impact on their clinical care or outcomes. But these things have happened in radiation oncology and radiation treatment and have significantly affected patients, in some cases leading to death. And these are just a few headlines from the New York Times from 7 or 8 years ago when there was a lot of discussion about a major radiation treatment error in the US that led to death of a patient. And this actually has spurred a lot of rethinking within the radiation treatment community generally about how to approach incident investigation and learning, and how to strengthen across the board our ability as a community to do this. Around the same time as those incidents were being talked about in the US in 2010, a number of us in Canada came together and said, there's an opportunity here as well to start thinking about the quality and the safety of the care that we're providing our patients while they receive radiation treatment. And this really was the genesis of the Canadian Partnership for Quality in Radiotherapy. And CPQR is an amalgamation or a collaboration, if you like, among the 3 professional groups involved in the delivery of radiation treatment: the Canadian Association of Radiation Oncology, the Canadian Organization of Medical Physicists, and the Canadian Association of Medical Radiation Technologists. And we were fortunate, in addition to getting buy-in from those 3 organizations and strong support from those 3 organizations, to also have the buy-in from the Canadian Partnership Against Cancer, which has a responsibility for building capacity and assuring a high level of system performance for the entire cancer control program across Canada. And CPAC was very helpful in providing us with both strategic input and strategic support, and also financial support to enable what we've been able to do over the past several years. And we set out to establish Key priority programs, these are the first 4 programs that we set about focusing on back in 2010. One was around programmatic quality indicators and accreditation standards. These have now morphed into Accreditation Canada standards for radiation treatment programs across the country, and they came into effect over a year ago. The second was all the great work of the medical physics community in Canada around technical quality control guidelines. These are guidelines to ensure that our equipment, the hardware and the software work as we think it should be working. The third was national incident learning, which is the focus of our conversation today. And of course, patient-centered care is a big aspect of everything we do, and it sort of permeates all aspects of the work that CPQR has done. So with respect to incident reporting and learning, we recognize that this should be a priority in Canada. It was happening in the US as a result of those incidents, and we recognize that it was important for Canada also to have such a system in place to learn from our incidents, our errors, our mistakes across the country and prevent them from happening again. And we were fortunate to be able to collaborate with CIHI in the development of the National System for Incident Reporting and Radiation. They had spent a lot of time and invested a lot of money in developing a very similar system for medication error in Canada. They were really, really anxious to leverage that investment and apply it in other circumstances. We, on the other hand, needed a partner to enable the system to be built and needed a partner who would be able to address all of the privacy and confidentiality concerns around reporting incidents centrally across the country. And CIHI, of course, has all of those safeguards built into their systems and standard operating procedures. So it was a natural collaboration, and it's worked extremely well. There was a lot of effort went into developing a taxonomy or a language, if you like, for how we would report incidents in Canada. Refining that through several iterations, going out to the community and asking them for their input and advice on how to make it better and more relevant to their day-to-day activities with patients receiving radiation. And then a lot of iteration around how to implement the system in a way that was user-friendly and accessible to everyone across Canada. I should say as well that we're not the only people doing this. There's a lot of interest elsewhere globally. You can see that there are several areas of activity in addition to Canada. In the US, there's the Radiation Oncology Incident Learning System, ROYLS, which came online just slightly before our system in Canada. The UK and Europe have ROSIS and SAFRON, SAFRON being a relatively new system that's been developed by the IAEA, and Australia is still in the development phase. They're talking about an incident reporting system, and we're certainly hoping to collaborate with them to help with that development. In general, we realize that the strength of incident reporting is about collaboration. It's about sharing information in an open and unbiased way, and learning from each other in Canada, which is the focus of NSER RT, but also reaching out and collaborating with our partners on an international scale, because the more data that we have available, the more likely we are to benefit from this kind of activity. Coming back to our system in Canada now, it's been operational for about 3 years. There's been uptake in many, many provinces across the country. There are still a few gaps, as you can see on this map. British Columbia is interesting because they're about to come online with a batch uploading system for the entire province. BC is already very centralized in how they do incident investigation. They report all of their incidents centrally, and they're collected and analyzed in that way. The plan with British Columbia is to capitalize on a feature of NSER RT that allows a sort of a one-button push and have all of that data uploaded to the national system. So we're very hopeful that they will come online shortly. This just gives you an idea over the past 3 years of the activity, the number of cases that have been reported. And you can see that it's been a pretty steady climb from the fall of 2015 when we first opened the system. It's roughly about 800 cases per year. I think we can do better. This is fabulous, but I think we can do better. I think there's a lot of opportunity to actually ramp this up further. And as I said, the more centers that are participating and the more data we have that's of very good quality, the better we will be able to utilize that data to look for trends and patterns that will influence how we might improve our system performance overall. So why are we focusing on incident investigation in this course? We have this nice system in place. It's open for everyone to use if they want to on a national scale and to benefit from that. The reason that we think incident investigation is so important is that it really comes down to garbage in, garbage out. If the data going into our national system are not good data to begin with, it's going to be very, very hard for us to analyze that data, interpret that data, extract meaningful information from it. So we really believe that there needs to be some degree of harmonization across the country in how we all are investigating the incidents that happen in our program on a daily basis. This concept of an organized approach will enhance learning on a national scale, and I think also on an international scale, and really amplify the pan-Canadian benefit of what we're trying to do. So the focus of the course is, as I've mentioned, the Canadian Incident Analysis Framework, which is shown on the right-hand side of the slide there. And it really walks through a series of steps that begin with the organization of a program before an incident actually happens, through the immediate response, the detailed analysis, the follow-through, and finally closing the loop with those in the program who would benefit from the learnings that have occurred. You're going to hear a lot more about this over the next 2 sessions, and for that matter, over the entire course. I guess the other thing that is very important to recognize is that from a patient-centered care perspective, our patients really want to know what happens when things go wrong. I think that they don't expect things to happen, but they acknowledge that things sometimes can happen. And when they do, they want answers, and they want to actually be involved in the process of investigating these incidents so that they can contribute and actually enhance their understandings of the problems. This actually comes again from the Canadian Patient Safety Institute, and it's a specific document, Patients for Patient Safety Canada, that actually outlines some of the concerns and issues that patients are interested in when an incident happens. So we have an obligation as practitioners to really understand ourselves what happened and to communicate this to our patients, and I think also to involve patients in the investigation when it makes sense. So where are we at right now? Well, we're very grateful that you're participating in this course. We think that it will contribute to harmonized incident investigation practice across Canada. It's part of what we think will be important to maximize impact of our National Incident Reporting Program. It's also part of promoting pan-Canadian utilization of the national system for incident reporting. The more high-quality data that are in there, the better and more effective it will be. We have a plan in place to analyze pan-Canadian data systematically and report these findings to our community in Canada, and for that matter internationally. And there's an ongoing plan in place to review and refine the NSERB system, the taxonomy, the language, how the system works, to keep it relevant to the Canadian radiation treatment community. So we value your input and your thoughts about how to make this better, and to send us your feedback, not only about the course, but about the system in general, and your thoughts about enhancing it. Lastly, we really are hoping to strengthen our international collaborations around incident reporting. And I think this is actually really an exciting time, because I believe that Canada and the Canadian community is on the forefront of some of the exciting activities that are happening internationally, and that we can lead this as a country. These sessions are really designed to to enable you to build and use an incident reporting system locally in your cancer center. It also will provide, we hope, tools and guidelines so that you can better understand how to investigate an incident locally based on the CPSI guidelines, root cause analysis, for example, and also how to classify incidents in an appropriate way. It will allow you to use NSER-RT more effectively and more appropriately. And I guess at the end of the day, we want to continue to promote pan-Canadian best practices in this domain so that we all benefit and our patients benefit. Thank you.